significant, and you could notice it immediately. And lift your eyebrows. She still has the upper horizontal lines, but the lower lines are now eliminated. Okay, you can relax. So at some point I'm going to want to inject her a little bit more in the upper forehead to eliminate these lines to see if we can flatten them out. The Restylane was again given in a serial puncture technique here along these lines, and we have a softening of the lines. Even though she can still make them, they're not quite as deep as they were previously. Shantae has been telling me that she's concerned that she's developing some fairly deep periocular rhytids. And when I took a look at her, I noticed that she actually does have one fairly deep line that is directly opposite the outer canthus. And it's the same on both sides. You can probably see it quite clearly. She does have some other lines in the area, but she has that one prominent line just in the middle. So she wants to see if we can inject some filler, some dermal filler in that area to try to keep her from developing any more severe changes in this area. So I'm going to use a mid-dermal filler, and I'm going to try to see if we can elevate that area just a bit. I've already injected a small amount of Botox in this area to try to prevent her from actually forming these lines. I have given her 7 units on each side, and we're now going to try to inject the Restylane. So I'm just going to turn her head just to the side. We're going to start in the medial portion of this line, and we're try to stay as superficial as possible to see if we can really get some elevation here. And it's going to be sort of difficult to see, but I think you may be able to see just the little bit of elevation that we're getting. We're not trying to produce a dramatic effect. Only a small amount is needed to really get this line to start to iron out. And I think we've already gotten quite a good response just from that very tiny amount of Restylane. All right, so I'm fairly happy with this result. Just almost immediately we've actually gotten a nice little elevation of this line here. And the Restylane that's in the skin will be absorbed just a slight amount, so she won't have that tiny little bit of elevation. But her skin is nicely soft, and so I think it's going to respond very well to this treatment. I'm just going to walk around to the other side. And let me just turn your head just a little bit. She's almost trying to develop a lower line here, so I might try to get just a little bit of that too. But we're going to do the same thing. Just inject just as high in the dermis as we can. There are some people who use Restylane with a smaller needle, a 32 gauge, to try to get an effective Restylane fine line. But this is a 30 gauge needle. All right. I'm just going to put just a touch in here. Okay, so you can see that small little elevation around that mid-rhytid. And I think we're going to get a very nice result using that in conjunction with the Botox so that she doesn't continue to form the lines. Shantae was concerned about the development of some perioral and periorbital rhytids. She noted that over time she was starting to develop some deepening of the lines around her eyes, specifically one just by the lateral canthus. I decided to give her a combination treatment of Botox and Restylane in order to get the most effective correction. She was treated with the Botox in the periorbital area bilaterally, and then I proceeded with the treatments with the dermal filler. She was treated with some Restylane in the upper dermis. This was to iron out the defect a little bit more smoothly. I thought she would get a better effect if it were in the upper rather than the mid-dermal area. She was seen a few days ago and felt that she had a very good result. I felt the same. The lines next to her lateral canthus were practically gone. She still had a little bit of a deepening of that line, but it had started to resolve, and I feel that over time that you will get complete resolution of that defect. Majid has told me that he spends a lot of time in the sun, and now he's worried about the effects of the sun on his skin. He's now developing a nasolabial fold that is deeper than what he feels is attractive for him, and would like to do something to preserve the integrity of the skin at the nasolabial sulcus. Can you smile for me? So you can see, especially when he smiles, there's a deepening of the fold here that we would like to correct. I would like to give him something that will last for a while, so I'm using a soft tissue filler that is fairly new on the market that will give us results that should last 1 to 2 years. This product, Radius, is a little bit different from some of the other fillers that I've been using or that we're familiar with. The hyaluronic acids are based on a substance that's found intracellularly and in between cells, whereas the Radius is made up of a substance called calcium hydroxyapatite. This is a substance that's found in bone, and it looks a little bit like toothpaste. It acts a little bit like toothpaste, that is in consistency. It's deposited in the subcutaneous layer. It is not deposited within the dermis. You can layer it down in the very deep dermis, but most of the time we go subcutaneously, just under the skin, and that's where it does its best work. This substance will not calcify. It does not turn into any bony substance. It does not become hard. It's suspended in a gel of carboxymethylcellulose. And the carboxymethylcellulose is absorbed by the body, and it leaves the calcium hydroxyapatite crystals, and then they actually can absorb fluid into the area and expand the tissue. One of the other benefits of this substance is that it allows collagen to regrow. The fibers of collagen will regrow in between the calcium hydroxyapatite and actually repair the defect that we're trying to correct, so that over time he actually will develop a more tissue underneath this nasolabial fold that will remain once all the particles are absorbed in a year or two. He'll actually get some self-correction in this area, and this is a great benefit that we found with this substance. Now, this is also laid down in a different pattern. That is, we put tiny little threads in, layering them right next to each other, as opposed to sometimes the boluses that we place with the hyaluronic acids. So I have already, and this also stings a little bit, and especially since it's subcutaneous, so I've already actually placed not only a topical anesthetic in this area, but also a little bit of lidocaine, so that it's not quite so uncomfortable for him. This is a little bip longer needle than we use with the other substances. This is a 27 gauge 1 1/4 inch needle. And I have just bent the tip just a bit because it just makes access easier.